Hi guys, welcome back to my channel. My name is Ziad, Crohn's disease patient, NHS worker and educator, here bringing you IBD facts and taboo breaking chats. Don't forget to like, comment, share and subscribe on my channel. So let's get started. Hello and welcome to this lesson on complementary and alternative methods used to treat IBD. So the first thing we're going to look at is fecal microbiota transplants. So despite the exact cause of IBD being unknown, the importance of the gut microbiota in IBD has been identified as vital. We know the gut microbiota is actively involved in the modulation of several physiological functions, such as in the immune response and resistance to pathogens. So a healthy gut is characterized by high levels of two major phyla, Firmicutes and Bacteroidetes, which are underrepresented in people with IBD whose gut microbiome show high levels of bacteria from the phyla Actinobacteria and Proteobacteria. Changes in the gut microbiota have been linked to intestinal inflammation due to dysbiosis, of which is frequently observed in people with IBD, causing a reduction in the microbes that produce anti-inflammatory compounds. As a result, fecal microbiota transplant, which in simple terms is a poo transplant, has been looked at as a promising therapeutic option for those with IBD. Essentially, feces from a healthy subject is taken and all the beneficial bacteria and yeast are extracted from it before they are transplanted into the colon of someone with IBD. Now, FMT can be administered either directly to the colon via colonoscopy, flexible sigmoidoscopy, or through an enema, or it can be delivered through a capsule that is ingested. Next, we're going to look at herbal and homeopathic therapies. So there are a number of herbs that can promote good health by aiding digestion or other processes of the body, as many can contain anti-inflammatory and antioxidant properties. Despite there being herbs that could potentially help those with IBD achieve symptom relief, caution should be taken when using herbs, as some, such as black cosh, fenugreek, flaxseed oil, and ginkgo biloba can have side effects which can cause symptoms such as abdominal pain, diarrhea, bloating, flatulence, and increase the risk of bowel obstructions occurring in those restricting Crohn's disease and can potentially cause rectal bleeding and liver damage as well. There are several herbs that are being looked at or are currently being used in providing symptom relief or trying to induce remission in those with IBD. When looking at homeopathic medications in IBD, it is slightly controversial. This is because the exact cause is still unknown of IBD, and the characteristics of the disease is chronic inflammation, which can be unpredictable and triggered by many different things. The most common homeopathic remedies that have been used to provide symptom relief in those with IBD include aloe vera, arsenicum album, bryonia, lycopodium, mercurius solbus, Nux vomica, and podolophyllum. They are used to provide symptom relief from watery diarrhea, abdominal pain, nausea, vomiting, mucus discharge, but there should be care be taken when having these, and medical advice should be sought before using any of these. Next, we're going to look at traditional Chinese medicine and mind-body interventions. So some of the herbs and spices used in traditional Chinese medicine are used in herbal therapies for IBD, and there is a growing interest in the use of other traditional Chinese medicine techniques, such as acupuncture, which is the practice of placing thin needles in acupoints of the body. There have been several trials conducted on acupuncture and IBD, which show promising results such as decreasing inflammation and disease activity with added benefits of reducing anxiety and depression. When it comes to mind-body interventions, these can be defined as interventions that use a variety of techniques to help facilitate the mind to affect bodily function and symptoms. And there are many different types of mind-body interventions, which do include aromatherapy, which is also known as essential oil therapy, biofeedback, which is the process of electronically monitoring the functions of the body, such as the heart rate and blood pressure, to help individuals learn how to gain voluntary control of these processes. Then there's clinical hypnosis, which is a technique that focuses a person's attention to narrow and deepen their concentration to reduce their awareness of symptoms. And then you have cognitive behavioral therapy, which helps individuals determine how they perceive themselves and their lives, providing them with goals, targets, and strategies on how to overcome negative thoughts. And you also have mindfulness-based cognitive therapy, which focuses on an individual's inner thoughts and feelings within each moment they occurred to help treat depression and addiction. And then there's psychotherapy. Those with IBD have higher levels of emotional distress in comparison to the general population, which can negatively impact on quality of life. Psychotherapy involves talking to a trained psychotherapist or counselor that can help in providing a safe space to talk about any issues or concerns, which can help decrease the impact and risk of anxiety and depression. So to summarize, we've looked at the complementary and alternative methods that are used alongside medical management of IBD.